Sickle Cell Anemia by Christopher Maloney and Michael Merriman, periods 1 and 2.
The stats. Sickle cell is inherited and affects 100,000 Americans. Sickle cell blood cells only live 10 to 20 days instead of the normal 120 days. Sickle cell disease is most commonly found in African Americans and Africans themselves.
Sickle cell has existed and been talked about for 5,000 years in Africa. American James B. Herrick was the first to write a medical journal on the disease in 1910. Deoxygenation in the blood was the first discovered in the 1920s by scientists Hahn and Gillespie. People always thought the disease was linked to genes and was hereditary, but it was unknown whether the assumption was true until in 1949 when it was proven by Dr. James V. Neal. The association with hemoglobin was first discovered by famed scientist Linus Pauling and his partner Harvey A. Tano in 1951, making it the first molecular disease ever discovered. The process for the actual amino acid substitution was first discovered by Vernon Ingram in 1956.
Symptoms of sickle cell anemia. Patients with sickle cell disease may develop severe pain in the chest, back, arms, legs, and the abdomen. Sickle red blood cells in the lungs can cause severe illness with chest pain, fever, and difficulty breathing. Sickle cell disease can also cause permanent damage to the brain, heart, kidneys, liver, spleen, and bones. The severity and symptoms vary greatly from person to person, even within the same family.
Sickle cell disease is caused by a genetic mutation in the gene responsible for producing hemoglobin. When oxygen is released from sickle cell hemoglobin, it sticks together and forms long rods, which damage and change the shape of the red blood cell. The sickle cell allele isn't completely dominant, so people with the regular allele for hemoglobin and the sickle cell allele produce both regular and abnormal hemoglobin.
Treatments: anti-inflammatory medications, antibiotics, oxygen, intravenous or oral fluids, and pain meds. Oh yeah.